All right, I hope this works. Chapter 9, Consultation and Documentation. All right, so if you don't already know what a consultation is, in our case, it's a client interview. So this is a meeting where valuable information is passed from them to us so that we know how to proceed with their treatment. Always remember to screen your clients before their appointment. This is why it's important to do like an intake form with your clients. Mine are all digital, so when they book the appointment online, it sends it to them. Not in Hope's case. I booked it and it didn't send it to her. But
5 days later.
yeah, you're welcome. So this will help gather information and make sure that they can actually receive massage and they don't have contraindications. So that's the main thing. So the 3 main questions you want to ask a client if you are actually speaking with them and not just having them go on your website or whatever to book is the reason for the appointment. This will rule out some weirdos, and also it'll help you to best plan their session. Okay? 2, previous experience with massage work. You want to know if they've gotten massage work. I usually ask how long's it been. Because if they are new to the massage world and have never had a massage, you want to break it down a little bit more for them. Like go in the room and say, okay, you're going to get undressed to your comfort level, which is what I usually tell people. Newbies, I'll tell them, most people wear their underwear. Some people don't wear anything at all. I'm like, you will be covered. This is my spiel. You will be covered the whole time. If I need an arm or a leg or your back, I'll undrape you and then keep the rest of you covered. Just because it's all like a mystery to them. They don't know what's going on. If you have a new client who's had massage, you can also do that same spiel with them so that they kind of have an idea of what's going on. I also tell them, for women, it is easier if you take your bra off. There's nothing worse than when somebody wants focus on their neck and shoulders and they're wearing a sports bra, which covers up 3/4 of the area you're trying to manipulate. Another good question is, how did they find out about you? You want to know if your advertising is working. So you want to know if it's word of mouth. Some places will do like referral perks for a client that maybe referred a new person to your office. Maybe they found you on Facebook. Maybe they found you on YouTube or Instagram. That way you know where to put your energy for advertising. I will say in this field, most of your referrals will be word of mouth. So once people start liking you, they're going to tell their loved ones about you. And that's just awesome, awesome advertising. If you do a bad job, that's also really awesome advertising, but not for you. Hold on, I'm doing some things. There it is. How to conduct the consultation. First of all, you want to establish open, effective communication and a good rapport with this person. So, always put on your professional face. People like that. It's important to explain any policies or procedures you have. This might be cancellation policies or policies on sickness. If they're sick, you don't want them there. This you can go over in the consultation with your client. In my case, again, the online forms automatically send. So it has my cancellation policy and it has my policies and procedures, which also goes over to please show up, clean. Anybody who is overly unhygienic will be sent home and not worked on. This also goes over sexual misconduct, so that mostly men, but sometimes women, so that there's no blurred lines there. Okay, this is a good spot to put that.
How would you, like if someone just comes in and they're just really dirty or stinky, whatever, like you just say, listen,
it's really awkward, but you gotta put your feelers out. Yeah, it's really awkward. You could tell them, our policy is usually to shower within that day so that, I don't know, make something up. It doesn't always happen. Sometimes people just came from the gym and they're sweaty, or they just mowed their grass and there's like grass clippings and pollen all stuck to them. I had some woman that just like stained her floors, and her feet were like black and sticky, and she wanted me to work on her feet. I touched the one and just did it over the sheet the rest. I was like, what is this? So for the dirty people, most people are clean, okay? Most people are respectful of you. They might smell a little BO-y, or maybe they worked all day and their feet aren't the freshest, but some people do hot towels on the feet. It's a extra little free perk. I offer, in the bathroom, we have these wipes you can use. I have them in the rooms, but I don't use them. But you can keep baby wipes, and maybe if there is a dirty spot, just tell your client, I'm going to wipe some of this debris off first and then do your foot, whatever. The worst part is summer with flip-flop feet. So people are usually just a little dirtier. So I don't care. It's not a big deal as long as there's not a weird funk coming from them. My secret, as long as there's no allergies for this client, is at the end of the table, I have a massage bottle holster hanging from my table with my massage oil with peppermint essential oil in it. So on the feed, they always get peppermint oil just because it's nice. Now, if you happen to have a client that is really gnarly, I've had some where the smell just knocks me off my feet. And it's usually like someone, like maybe it's like people who have a lot of animals, like the cat urine smell. I've had clients like that where I'm like trying not to gag, but I'm like, and I did tell the front desk not to book that person again when I wasn't working for myself. But sometimes you just need to put a little BioFreeze or some essential oil right on your nose and just power through it. Vapor rub. And it happens, but not often. And also depends on where you're working. If you're working for like a chiropractor or physical therapist, you might discover you're going to have people that are getting free massages through insurance or workman's comp, and they tend to not be as clean as your paying clients. Right? So keep an open mind with that. If they're totally nasty, you can refuse treatment.
How would you do that?
How would you do that?
How would you refuse treatment, like in general?
It's a very sensitive subject, but usually what I do is after the treatment, if I had something weird happen with that client, I will either call them and reach out to them and explain them privately, or I'll send them a letter and sissy out. That's how I usually will terminate the creepy or the really crazy clients that I don't want in my office. Is I'll send them a letter, therefore I have a copy of it in case they try to act crazy, and send them their letter and then put them on my do not book list.
Well, what if they're there for a massage and you're like, hell no, I ain't touching you?
You can say because of hygienic issues, we're going to have to reschedule this.
Hi, client. Before we begin, I need to talk to you about something important.
Yeah, you can. You can. Like, you can bring them, like you're bringing them in the room for the session, and
Go wash your crack. For
Yeah.
everyone's comfort and safety, it's important that clients arrive freshly bathed and clean, with clean clothing. Unfortunately, I can't move forward with today's session under the current circumstances.
there you go.
I'd be happy to reschedule you for another time once that's taken care of. I appreciate you.
Please take care of your stink.
Chat GPT it, man.
I love ChatGPT.
Oh, brother.
Moving on. All right. During the consultation, you want to determine your client's needs and their expectations. What do they need out of the session? What do they expect as a result? Sometimes their expectations are way too high. You cannot cure years or months or whatever of a chronic issue in one little hour treatment. So this is somebody, if you have a chronic issue, you have to slowly chip your way through. Kind of think of removing wallpaper. So it's a process, and sometimes I was telling Theo earlier, sometimes you can't get them to that 100%, but it's just giving them some of that relief. Next, complete and review intake forms and medical history forms. So if they arrive there and you want to have them fill out the form right before their session, I recommend them coming early. So you can put that in your policy. Please arrive 10 to 15 minutes early to fill out necessary forms. The reason why we need to know their medical history form, and I'm going to show you guys our medical history form today for the school, the paper copy, because we have it digital too, because I'm a balla. You want to make sure there's no contraindications, no allergies, anything you need to know to customize your treatment safely for them and for you, right? Remember all those communicable diseases? All right, so determine if the client is under a physician's care. So if they are actively going to the doctor for something, I'll just say for physical therapy, they're going to a physical therapist because they're post-surgical or maybe injured themselves. You want to make sure they are cleared to receive massage. So all you would need is just a letter from that doctor saying that they're good to go if you don't want to work on them, if you're feeling uncomfortable in a sort of way. And this goes with a lot of people are looking for lymphatic massage. Now, most massage itself will move the lymphatic system, but there's a specific modality called lymphatic drainage massage. It's super snail-paced. It's real slow, light, and boring. But if somebody comes to me and the lymphedema is just really scary, I'm not going to work on them, even though I do have training in lymphatic massage. So in that situation, you would say, when this clears up or when your doctor excuses you, let me know, bring a letter from your doctor saying that you are safe to receive my care. So contraindications, we already kind of threw that in, why you need a medical history form. Determine if the client should be referred out. Now, sometimes they should be referred out if they have an acute injury that's really concerning, right? Extreme sharp pain, a numbness that might be concerning. A lot of people come in because their fingers and things are numb. That's normal. But extreme cases is when you want to refer them out to a doctor per se, or maybe it's a specialty that you're not comfortable with and you've not done training in. You can refer out to a therapist nearby. I like to have a nice network of massage therapists so that I can do that. All right, so make friends with a massage therapist. They're not your enemies. They might be your competition, but they're also, a network is nice to have, right? All right. Shot for hope. All right, so the last one is perform preliminary assessment. So this is where we would assess the client. Now, you're not technically looking at them and checking all the levels of their hips and their shoulders, but you're kind of doing it just by visually, I guess I should say. So this is when you would assess the situation, see what their range of motion is, and I'll teach you guys to kind of look for like an imbalance. Effective communication. You guys are probably going to learn this in ethics too, but effective communication is the act of successfully sharing info between two people so that the info is understood. This also means to communicate on a level that your client understands. Do not be throwing a bunch of medical terms at them. Sometimes you have to, I don't want to say dumb it down, but bring down that level of education so that they understand. Because clients or people not in the medical field have no clue sometimes about their body, and that's okay. So it's our job to kind of inform them of things. During effective communication, you want to be observant and look for any nonverbal communication. So your clients, even though you tell them, let me know if the pressure's too much or if you're hot or cold, they might not tell you because they're uncomfortable speaking up. So this is when you look for gestures that they make, their posture. Maybe they're pulling away from you if you're pushing too hard or sinking into the table more. Look for facial expressions. Grunts or moans or anything is all a good nonverbal, I guess that's sort of verbal, but nonverbal communication. So throughout your massage, constantly watch for those cues. A big one I've noticed is the bolster. When somebody's flat on their back with the bolster under their knees, sometimes those bolsters push on the nerves on the back of your knee there and make the feet go numb. For some reason, it's some clients and some don't have that issue at all. So I'll notice that they're kind of moving their foot and I'll ask, is your foot numb? Yeah, it's starting to get numb. And then just you can remove the bolster for them. So something easy is just noticing them moving. It also can be an indication of pain. Maybe them laying on their back is starting to hurt their back a little bit. So you can tell them, you can put your knees up, whatever's comfortable, while I'm working on the upper body so that you don't feel uncomfortable on the table. You might have to reposition them multiple times. Put them into a side lying position for a little bit. So everybody's a little different. Most people can receive the standard massage and lay on their back and their bellies, but some people can't. Also be mindful of your own body language. You want to appear open and friendly and confident. If you act like you don't know what you're doing, they're going to know you don't know what you're doing. So I say fake it till you make it. It's a good thing to live by. If you don't know something and you put them in the room, get on your phone and look up that disease real quick. You have several minutes for them to get undressed and get on the table. Also, side note here, don't leave them on the table for more than 5 minutes. So once you put them in, be ready to basically get a drink of water, use the restroom, wash your hands, and get in that room within a few minutes. That's my advice to you, because the clients are going to be like, oh, I almost fell asleep, which I am sometimes guilty of that because I have 1,000 things to do. But try to keep it within about 3 minutes if you can. And if you notice they're laying there like 5 minutes, come back in and apologize for their wait. And don't dock them the time because it's your fault. Make sense? Continue looking for nonverbal communication during your treatment. I did say that, so that would include grimacing of the face, then flinching, fidgeting. That may indicate pain. Moans, sounds that indicate a positive feedback. It is super weird when people moan, but sometimes they do it. So you just have to navigate that session how you want. I usually kind of confirm, oh yeah, that's a really tight spot, because I find it weird, but to each their own. Communication during a consultation. You want to use open-ended questions. What I mean by that is questions that they can't answer using yes or no. So an open-ended question would be like, where is your pain? Not, are you in pain? Where is your pain? And then they'll be like, oh, it's right here, running up my neck. I have a hard time turning it. So that you can find a better solution. Some people don't want to speak up, so you have to use open-ended questions, just not like, are you in pain? Or have you had a massage? They would say yes. Or you can say, how long has it been since you've had a massage? So open-ended questions. Does that make sense, what that is? Okay. Use active listening. This is when the practitioner, so us, understands the client's responses, and we can summarize it back. So that might be a quiz question. Active listening means we are listening and we can repeat what they said. They say, oh, I'm having trouble with my right side. You can reiterate that if you forgot to. Sometimes I'll go back in the room and be like, it was the right hip, right? And they'll be like, yeah. Or no, it was actually the left. So if you forgot, it's okay to ask again. But what I do to try to help me remember is when we're doing this consultation in my room, before they get undressed on the table, they'll touch their hip and I'll touch the same one. So I kind of have like a mind-body memory of, okay, they said left. Or maybe I'm like, okay, my left knee is bad too, so I remember their left knee. So just give yourself little clues like that. So when you are actively listening, be with the client and concentrate on what they're saying. Wait until they're finished speaking. Nobody wants to be interrupted. It happens sometimes because some people just aren't good at communicating. I'm not the greatest. Then you want to repeat what your client says so that you remember, and then they also feel like you are listening to them. At this point, you can get your agreement from your client about the treatment plan. Typically, I'll say, are we doing upper body or just focus work today? What brings you in is usually how I start, or something like that. What brings you in is basically it. And then they'll be like, oh, I'm having low back pain. I'm like, are you having it radiate down your leg? What side? Stuff like that. And then you can tell them, okay, I suggest doing most of the time on the legs and the low back and the glutes. But if you want a full body, I can just kind of skim over those other areas. Or we can just do everything evenly, or we can just focus on what's the issue. So you can cater to your client and kind of customize the session to what they need. It's not going to be the same massage for everybody who walks in your door. Our massage, you're not going to have the same routine. Yes, you'll have a routine that you stick by that you'll kind of alter depending on what's going on with your client, right? What is the purpose of a consultation? This helps us learn, or helps our clients learn about our credentials. So on the website you might be having, or your booking app, people like bios, people like pictures. They kind of feel more comfortable knowing what they might be walking into. You want to outline your policies and procedures. So this is important so that everybody is on the same page. For instance, if you have a cancellation policy, this is where that would go. I have them sign their cancellation policy, and if they didn't read it, it's not my problem. You might want to book an appointment with a card on file, and in this policy section, you can explain why, because of our cancellation policy, and if you don't show up, you are charged in full. Most people do a 24-hour cancellation policy. I do a 48 because I found it's a lot harder to fill those last-minute appointments if they cancel the day before. A lot of people aren't looking the day before. If they did, they'll notice there's no spots, and chances are they're not going to go back on your website and see if you have another one. This is also a good place where you can have a wait list. If somebody cancels, be like, maybe somebody was trying to make an appointment at that spot, and you said, I'm sorry, I'm full, but I'll put you on a wait list. That way, if somebody cancels, I will get a hold of you and see if you want that time slot. So that's important too, for all the policies and procedures. Another purpose for the consultation is client conditions, needs, and expectations. So that's why they're there. You want to find out why they're there. This would also kind of rule out any contraindications where you might need to refer out. And when your client is signing this intake form, usually there's a little tiny thing on the bottom that is like your informed consent. And this is the written authorization for your professional services. I'm going to read this real quick. This one for the school, it just says, by signing below, you agree to the following. I have completed this form to the best of my ability and have knowledge and agree to inform my massage students, you guys are students, or therapists in this case, if any of the above information changes at any time. So we need to know, again, if they have a surgery, you can update their intake form if you want, or just put it in their client notes. So no matter how many times you've seen these specific people, each session should always begin with a short little question and answer period. Like I said, usually for me it's, so has anything new changed, or are there any new health concerns I need to know? And they're like, no, or yeah, I fell last week. So you might have to actually alter this massage a little depending on the new issue that we're now dealing with.
Bridget, are there, do you use paper forms, do you use, digital,
Mine's digital, and then if they don't fill it out at home, I have a tablet in the office, they can do it. For some clients, you might have to fill it out for them. So older clients or people who just have no clue how to use a tablet.
Yeah.
I've had clients that don't speak English and their significant other had to fill it out. So
for your soap notes? Are
Oh, for soap
you-
notes.
Yeah, cause I've worked in
Sorry.
optometry practices where we have had paper files and then where we've had digital files.
it's up to you what you want to do. I like digital so that I don't have to have all those papers. Because if your client comes weekly, that's going to fill up very quickly. So it depends on what you want. I've done both. I personally like the digital so that it's I can look at your name, look up Hope. I can look at her forms, her intake forms, any of her soap notes, all of her appointments she's made. Digital is the way to go. Now, some of you are old school and want to do everything by paper, and that's fine too, okay? Doesn't matter. I've worked places that did both. So, all right. During your policy and procedure form, this is where you want to explain procedures and state your policies. I'll have to bring up mine for you guys sometime so you can see. So policies would be your late or cancellation or no-show policies. You can put in there if you're more than 15 minutes late, you automatically will be rescheduled and have to pay for your missed appointment. You can put something like that. You can do a deposit if you don't want that. Maybe a 25 or 50% deposit or a dollar amount that's non-refundable that will go towards your appointment. However you want to do it. You can look up examples of this or ask local massage therapists what they do. If you guys ever have questions, you can copy my stuff. I don't care, right? So you want to just make sure there is a written policy for your clients to go back and read. This also goes over, like I said, sexual boundaries and any disclaimer that we cannot diagnose or cure a disease because we can't. So we're just helping the body to heal just by giving it a boost in a way. And we can't diagnose. We're not allowed. It is not in our scope of practice. We cannot say, oh, you have a rotator cuff tear. You can say, I think you might have said issue. I want you to follow up with your doctor where they can diagnose you. So that's all policies. So for the procedures, this is to keep your client informed about what is being done and why. So that typically will kind of be going in with that question and answer consultation you're having when they're face to face with you. Determine the client's needs and their expectations. So you want to know your client's main concerns, what their complaints are, bodily complaints in this, or physical, mental complaints, who knows? Because you'll soon learn that you are also a therapist, not getting paid for that part. You want to determine the type of massage being performed. Like I've said, you're not going to do the same massage for everybody. You might want to bust out different moves or different modalities depending on that client's needs. This is a good place to ask them what the pressure is that they prefer. I actually put it on the intake forms. This one has light, medium, deep. You can break it down more to light, medium, firm, deep, whatever you want. And as you guys get used to pressures and learning how to do different pressures, everybody's medium is different. So it's hard to say. That's why it's important to check in with your client, because I have a heavy hand naturally. So when I do a medium massage, I have to really tone it down. So always make sure the pressure is preferred, whatever it is. And they might want more pressure on one area and less pressure on another area of the body. So it's good to communicate a few times during the session how the pressure is. I like to do when I first start, maybe when I get to the legs, because the legs are kind of a tender area. And then if there's like, say you're doing the back and you're going to use an elbow, make sure that's cool. You'll hear them. They'll be like, ugh. So just keep asking them how they're feeling. Now, also, there's an opposite spectrum of that. Don't ask them 1,000 times because that's annoying. So you have to learn when it is best, and you'll learn by massaging and having clients what is the best plan of action for yourself for speaking up during a massage. So you want to know what the treatment goals are, their expectations. Like I've said, are they reasonable goals? Yes, maybe. No. And explain to them why their goals might take longer. This rules out contraindications. And last case scenario, if you need to refer out. So this is why it's important to get these documentation or get the consultation done. All right, we're going to talk about obtaining intake and health history forms. So this is information received during the consultation, and it becomes part of the client's permanent record. So as long as they are your client, you will have an intake form on them. I don't know what happens if you don't, but I don't want to find out.
Are there no state laws?
That's a
mandating
good
how long
question.
you need to keep a client informed?
I think typically, isn't it like 7 years or something for medical records?
I want to say yes, because it used to be 10 and they changed it a few years back, and I believe it's 7.
It might be 7. I might be thinking of taxes. That might be
No,
7
I
too.
feel like that's right, but I've been out of it for a year and a half, so I could be wrong.
Well, my system is, if you haven't been there in, I believe it's 3 years, it automatically deletes you. So they would start fresh as a new client each time.
Does it not archive it?
It does, but I set it up like that to limit the amount of spam emails I'm sending out.
Sure.
Because some people, if they haven't been there for 3 years, they're probably not going to. And they don't want my emails. So I do that because I'm a kind human. Also, if they haven't been there that long, you might want to do an intake form. You might want to do a yearly intake form and have them freshen up each year. I typically don't because I just did the consultation. But if that's your policy, you can even put that there will be a yearly intake form that you have to renew. Where am I at? Also, like I was just talking about, that might change over time where they need to update it, right? Intake forms will have the following information. You can typically, I would say, do this little, I can't even word. These are the things that are typically on an intake form. You can alter it, is what I mean to say. So you want their name, full name, first and last, not just Bob getting a massage for 60 minutes, relaxation. And contact information. If the client does not want to give you first and last name and their phone number, do not book them. They are there for the wrong reasons. So those are the big ones. I like to throw in the emergency contact just in case something goes down while they're there. Maybe they have a seizure, a stroke. I'm getting like really exaggerating here. But emergencies happen. So you want to have an emergency contact to get a hold of in case something does happen at your office. Now, clients don't understand this next part, career or hobbies. I understand this next part because what you do for a living, how your body's constantly moving, and your hobbies determines what your muscles and your posture is doing all the time. So the reason why we need to know this is so that we can treat them appropriately. Medications. You want to make sure no medications are contraindications. And you're like, which ones are those? Basically, the main thing you need to know is if they're being treated for blood pressure, if they are on a blood thinner and a pain pill. The rest of it, I don't care what they are on. A blood thinner will mean they will bruise easier. They might not be able to take as much pressure because they bruise easier. You want to make sure their blood pressure is controlled with their medication. And the reason why we need to know about pain pills is sometimes it alters their perception of touch. Yes.
Are we talking pain pills like Vicodin, or are we talking pain pills like ibuprofen?
Kind of both, but I'm talking about the heavy duty guys. So Vicodin, oxycodone, something like that. Percocets.
Okay.
I
so
have
if
a-
somebody's like,
yeah.
Yeah, I took acetaminophen 20 minutes ago.
Yeah, but you can ask them why. You know what I mean? Also, I like to tell people there's a difference between acetaminophen and ibuprofen. Acetaminophen, which is Tylenol, is a pain reliever, fever reducer. The opposite spectrum, your ibuprofen, which is in the NSAID, non-steroidal anti-inflammatory drugs, hence the name, is an anti-inflammatory, and that's how it reduces your pain. If they're having inflammatory issues, their go-to is probably going to be an anti-inflammatory. So your naproxen, your ibuprofen, there's a bunch of others. If they need medical intervention, they might put them on a steroid. So that's not an NSAID because that's an actual steroid. But we need to know these things just so we know how to proceed with the massage. Sometimes steroids flare people up. So maybe what we're feeling isn't necessarily terrible, and their swelling has to do with the medicine they're on. But yeah, those are the main medicines you need to know about. All right, because there's so many medicines or medications out there that you're like, I don't know what this is. Unless you know somebody who takes it or take it yourself, you might not be aware of it. And that's okay. Where am I at? Medical diseases or medical history. This would go over their diseases, injuries, surgeries. A lot of people forget to put stuff down. I'm working on them, and I'm like, they have a scar on their knee or whatever. Have you had a knee replacement? Oh, yeah! 7 years ago. Like, okay, that would have been nice to know. Some people forget. So you can ask questions while you're noticing things, but don't get too chatty because some clients don't like that. Allergies. This is a big one, and I'm not talking about just seasonal allergies. I want to know if you're allergic to the stuff I'm putting on you or the smells. Try not to have too strong of smells in your treatment room. I do have a candle warmer melting in my lobby that sometimes is a little strong when I first turn it on. So you might want to not do that. Listen to me. Or just be mindful of smells. I've had clients where if I know they're really sensitive to smells, I'll turn that off or not have it turned on until after they're there. So you want to know also in the intake or the or the intake form, the reason for their visits. Usually there is a section here. It probably does. What are your goals for this treatment? Expectations. If someone referred them or where they heard about you, you can throw that in the intake form for funsies. A disclaimer that you can't diagnose, right? Shot. Administer body diagram. So some of your intake forms might have this little bad guy. We have it here. This is the paper one in case somebody comes in and hasn't done our digital one. I should just pass it around. I will after this. This picture here, you can have this. This is a little diagram where you can ask them to touch or point or circle or X, whatever you want, the area of discomfort on the picture of the human. So they can place an X and then they can indicate their pain scale 1 to 10. So pain scales of 1 means barely at all. 10 means you're getting mauled by bears. So try to explain that 10 is the worst. Some people have a really low pain tolerance, so I try to tell them 10 means you're basically dying in the worst possible way. So most people will tell you, I don't know, pain scale of about 6, 7, 8, somewhere around there. That means it's a lot of pain. You can have them shade the areas of soreness or where it radiates down to or numbness, whatever you want to help you just determine what you want to work on. You can circle the condition or area of concern. So in this picture I have an X, and I didn't put a pain scale because I'm a slacker, but I have an X, a green X on their left scapula, medial border. So that's like the rhomboid section, some trapezius. So maybe they're having issues there. They have a knot. Maybe they slept weird. Maybe they are a student and they're hunched over on their laptop studying for anatomy and physiology. And then next I have shaded area. So they might want to take their pen or pencil and shade an area that's sore. In this case with the picture, I'm having soreness on the lateral side of the left leg and into the kneecap. And then they can circle the condition or area of concern. So a good indication is the knee hurts because of the muscle that's sore, or the muscles are sore because the knee hurts. You just have to figure out what is what. And it can happen either way. So a joint can cause muscles around it to be sore because those muscles are trying to stabilize, or the muscles are sore causing a dysfunction in the joint. Does that make sense a little bit? Conduct and preliminary assessments. So this includes your client history, observation, and examination. So our examination is not what a doctor's examination would be per se. Unless you are one of those awesome clients that does like a full assessment and does range of motion, we don't have time for that in our field. And if you do, you need to be compensated for that time. So your appointments might be 75 minutes because of a 15-minute assessment. And then maybe there's an extra charge for that. Maybe that's just for their first visit. So you are free to do what you want if you're working for yourself. If you work for somebody else, you might want to ask about things like that or see what their procedures are for this. So during this assessment, you want to determine the type of massage. If they're booking online, you can have different types of massages with the descriptions so they can determine what they think is right. In this case, I just put relaxation, which is your basic Swedish or your basic spa massage, very light pressure, not assessing any concerns or pain, right? And then therapeutic, this is more in depth. So this has the therapeutic umbrella of all the other modalities that are under it. So that deep tissue would be under here. It is a therapeutic procedure or treatment. You might want to put myofascial release because we are treating pain. There's a bunch. You guys will learn about these modalities as we progress through the program. During this, we're going to look at, we're going to observe their gait and posture. And you're like, what's that? Gait means how they are walking and how their body is walking. We're going to learn that second semester, actually kind of assessing the gaits and how the foot strikes the ground and whatnot. But in this case, it's just watching how they walk. You might watch how they walk into the room, and you'll see that they have like a little downward limp on one side, or maybe one of their shoulders is really highly elevated. So that's indicating there's something going on here, right? That's pulling the shoulder upwards. So just kind of look at the posture, and you guys are going to get more used to that. You can continuously observe them during the treatment too. So how they're laying on the table, maybe that shoulder's still raised while they're laying, so that will indicate there is an issue there. So while you are continuously assessing them during the treatment, you may need to modify or adapt different techniques to fit your client's needs. You also might need to throw more pillows under them or prop something up to make them comfortable. I'm gonna, not to be braggy here, I'm gonna kind of show you something real quick, get off the screen, on my website. Ooh, just so you have a clue. So my business is called Zona Earth Massage. It's in Cambridge. I'm just gonna go to the book thing so you can see here what I'm talking about when I say descriptions of different types of massages. So I'm just going to go to services. And in here, I'm going to click this, unclick here. We're going to go to massage. So in this section here, and I'll zoom so you guys can, if it lets me, zoom a little bit. I have my therapeutic massage as the first massage available because that is, I'd say, what 75% of people get is therapeutic massage. The other is deep tissue and once in a while relaxation. So in this case I'll zoom here. There, it does work. So 30-minute massage. It also, I like to put what the pressure is for this. This ranges in the medium to firm pressure. You don't have to do that, but this helps them determine what they want if they don't know. A lot of people don't know the different types of massages because you didn't when you first started, right? Most of you. So I have a little description here. It says our most popular massage. It offers a mix between relaxing strokes and increased pressure. Your session will help ease your muscle tension, melt away knots, reduce pain, and aid in recovery. I also have a little section here that I have double starred. For a full body massage, please schedule at least a 60-minute session. 30 minutes are designed for spot treatment only. So 30-minute might be neck and shoulders. Maybe I have a avid cyclist that does his legs only for a half hour. So if you are offering anything under 60-minute, I would let your clients know that you cannot do a full body. There's no time for that. It's hard enough in school to do a 50-minute section. All right, and then just for funsies, here's my deep tissue. Again, deep tissue, deep pressure. Deep tissue massage focuses on treating musculoskeletal issues. It involves applying deep pressure to target the inner layers of the muscles and fascia, perfect for individuals with chronic pain and very tight muscles. So if people are like, that resonates with me, that's what I want. Now, they might book wrong. This is why we ask them what they want before we work on them. You might need to change what they get in the system so that you can go back and look, okay, they did therapeutic massage last time. Why do they want deep? Was it not deep enough for them? Did they book incorrectly? Sometimes they'll, depending on flare-ups or how they're feeling, they might bounce between a deeper pressured massage and a lighter one. So, and then again, I have relaxation massage. I have my prenatal massage, all under the massage group. All right, let's go back to the slide. So there we go. Next slide. Developing a treatment plan. This is an outline that we can follow when giving massage treatments. It doesn't necessarily mean you have to write the whole treatment plan down, right? You kind of know when we do the soap notes what happened in the massage, and then there's a section at the end that says planning. So that would be future treatments. Maybe you want them to come back monthly or come back in a week and work on this area specifically. This is the treatment plan. You can do more detailed soap notes or extra notes that aren't soap notes if you want to have a more detailed version of this, right? If this doesn't happen in the first appointment, look at previous intake or soap notes to refresh your memory, like I've said. Or if another therapist worked on them, you might want to refresh your memory on what they did. Now, everybody has their own lingo with soap note writing. You are going to have to figure out what they're talking about. So a lot of abbreviations. And I'll go over, I think I made a fake soap note here. I'll go over that shortly. So during the treatment plan development, conduct a brief post-treatment interview with your client. So this would be like, how do you feel? Or how's your pain? It was a scale of a 7. How is it now post-treatment? You might also want to be an overachiever, and I think about this all the time, but I don't carry through. But you might want to reach out to them a day or two later and ask them, how'd the treatment go? Are you sore? And then you can explain if you are sore, maybe do a heating pad or ice, depending on the situation, or what you would typically do for pain. Because sometimes a deeper tissue or a deeper massage might make them sore for up to 3 days. If it's more than 3 days, you went way too deep. Typically, it's only about a day or two. That's normal. It's okay to be sore after a massage. Don't be a sissy, guys. Nobody wants relaxation. Only if you're on a cruise ship. All right, so you want to know if they have more pain, less pain, because sometimes you will put them into a flare-up with a massage and things are worse. Things can get worse before they get better, and it's okay. Just tell your clients, continue aftercare. Ice is amazing for bringing down the inflammation. During this treatment plan, this is where you would determine which techniques were effective, which weren't. If things were effective, you can do that again. If things weren't, you can alter how you do things, or maybe if you're unsure, go on YouTube and look up some videos on how to release this or whatever issue your client is having. And that way you are more prepared. Continued Ed is also amazing. I think, did I make most of you sign up for ABMP? Some also have AMTA. Yeah, ABMP and AMTA have free CEU videos you can watch all the time. Those are awesome. So you might have to change your techniques depending on the session. All right, everybody, it's different each time. This is self-care recommendations. You might recommend stretching or having them get a foam roller or a tennis ball or something to work out their own knots in between sessions. I used to be really good about this, showing them stretches, but you get a little lazy as you get older. I have a therapist in my office who is always like getting on the ground, and she's like, do this. So she's really good at giving self-care recommendations to the clients. My recommendation, if you're doing a stretch, is show them the stretch and have them repeat it so you know they know how to do it. Or if they can't do that stretch, some people just can't get their leg up. So they need to have a modified stretch. You can actually get printouts for this. You can get your own YouTube videos or make your own videos on certain stretches so that you can give your clients this homework, and it's an area that you can access easily and give to your clients as homework. Now, I'll also tell you this, your clients are probably not going to do their homework. So some of them do, and it's awesome because you can see them progress. And some of them just want to throw money at you and have you fix them. So there's that too. A big one is water, 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 water. Have your client be aware that they need to stay hydrated after and before their massage. Some don't want to drink a lot before because they don't have to go to the bathroom in between. But afterwards, you can give them water. You can keep little bottles of water. I have a water cooler because some people don't like the taste of water. So I say just suck it up. You can also tell them do a Gatorade or any kind of liquid that is not a diuretic to help them flush out any of the cellular debris we maybe worked up, which is the toxins, they call it. Also, if you aren't fully hydrated after getting a massage, you can have flu-like symptoms afterwards. So if they feel disgusted or disgusting afterwards, it's probably because they're dehydrated. So have them drink. So the diuretics would be obviously the caffeinated things. Alcohol will dehydrate you. It's not best to drink a bunch after a massage because it's going to make you more sore. Kind of like also if you work out after a massage, keep it a light workout, maybe do cardio that day because it's going to be like a double workout on those muscles, those muscle groups. So you can also have extreme prolonged soreness if you don't take it easy with your workouts after the massage. We have a lot of clients who will be like, we get a lot of CrossFitters. Can I work out after this? Well, I wouldn't recommend it, but if you're not going to listen to me, drink a lot of water and stretch. So just know you will be more sore.
If they work out before, the fascia is really loose.
Yeah.
It's
So working out before is okay, but also you might have the soreness depending on how hard they worked out with the massage after the workout. But man, nothing like when your muscles are sore and it's the massage day. It's so good. And when you massage them after a workout, you're actually increasing the nutrients in the blood to that area, so they are prone to heal faster, which is why it was so important bringing massage into the Olympics to help the athletes. So here is an example of an informed consent. We have a couple slides, and I'll let you guys take a little break. Everyone looks like they want to just die right now. The rain. All right. Informed consent is an educational process that ensures that the client has received enough info to understand the nature and extent of your services you are offering. This would be preferably include a signed and dated form and kept in your client's files. I'm going to zoom so you can see what I'm talking about. You can have a long form like this, or you can have a tiny little form that just says, by signing this, blah, 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 like I read before. So this is the long version. By signing below, you agree to the following. And I'm not going to read each one, but I voluntarily request and consent to receive massage therapy. Blah, 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 blah. I do not have any injuries or conditions that prevent me from receiving massage therapy. And then down here's a good one. I understand the risks associated with massage therapy include but are not limited to superficial bruising. Yes, massage can leave bruises. It's not ideal, but it can. Short-term muscle soreness, usually 1 to 3 days. Exacerbation of undiscovered injuries. All right, so they might have an undiscovered injury. Now you're tinkering around with it and super inflamed and ticked off. So, like I said, massage can make things worse before it gets better. I've noticed a lot of people, if you have a pinched nerve in your neck, yes, the massage is really good for it, but also some of the techniques will make it way worse. I've actually been in the ER because I thought I was having a heart attack a couple years ago. We're good. My heart's good. I had a pinched nerve in my back from a deep tissue massage that was radiating down my left arm into my chest. Felt like heart attack situation. I was having heart palpitations because I was having anxiety from it. Turns out it was a pinched nerve from a super deep tissue massage. So well, she was. About that. We're moving on. This is being recorded. Not at that time, she wasn't. Oh.
Sorry.
It was an accident.
Sure.
Not the firing, but that was an accident, the pinched nerve injury. She's probably like, this will teach you. All right, keep documentation and your client files. For how long? We have no clue, but we think 7. Did you look it up?
Yeah,
Okay.
it's 7 years.
Hope looked it up at 7 years.
Don't hold me to that. I'm not liable, but I think.
She's not liable. We're going to have somebody, have you guys sign a form. All right, documentation usually has your intake form. This would be your personal information, hobbies, right? Getting to know your client a little bit. It doesn't have to be super extensive, but to kind of know why their body is in the way that it is, all right? Health history form, probably most important. Treatment plan, informed consent. There is something called a medical release form. This is if you need to release, we're going to go over this here in a bit. Not all documentation will have a medical release form. This is releasing them for therapy, right? SOAP notes. This will stay with your client's files. Mine are digital. I should pull up mine. We'll do it when we're not recording. So that in case I click a name, it's not a HIPAA violation, right? Financial records. So if clients need their financial records printed off, say they're trying to get reimbursed through insurance, or maybe this was a workman's comp thing and you don't take workman's comp, so they need to get reimbursed. Or if it was maybe a private situation, maybe there was an accident and the person said, I will take care of your medical bills, and now you need proof that they were there, you can print these off for your clients. So this would be financial records and any billing information. So I have a big green box that says online services and software is available to store digital forms and notes for clients. I use most booking softwares will at least have the form section. Not all of them have soap notes. I use a system called Vagaro, and they have both, and that's why I have it, because there's a lot of features on there I like. I think there's also Massage Book is another really popular booking software that has, I think, both. Then there's Gloss Genius is another one. I'm not sure if Gloss Genius has soap notes. I believe it does not, and that's why I never went and used that, because I want the soap notes. But if you want to do paper soap notes, you can do whatever booking software you want.
I believe the AMBT, whatever, the one insurance company.
Yeah.
I'm gonna sign up for, I believe they use Pocket Suite and they actually have a free subscription.
They
to
do.
go with them. I
And
don't
it
know
has
if
soap notes.
Okay.
I kind of looked into it before I chose the school software, which has, I don't know if they have soap notes on the school. We use Fresha here at the moment, but they do have intake forms. And that's the main reason why I wanted it, so that it makes our booking a lot easier and I don't have to answer 1,000 phone calls. But yeah, when you're getting into finding a software, it's best to do your research and figure out what your needs are for what you want. Digital is the way to go. Soap notes. Got a couple more slides, and we're going to dive in when we come back and do some look at the soap notes, the diagram I have, and kind of practice a little bit. I'm going to have you guys practice soap notes after working on each other today, because the sooner we start it, the better you'll get at it and understand it a little bit more. So just going to keep throwing it at you. Repetition is the way to learn. So soap notes, you're like, why is it called a soap note? Well, it's because we use a bar of soap. I'm just kidding. So soap is, I forgot the term, not abbreviation. Acronym? Yeah. Acronym for the words. So the S in soap is subjective. The O is objective. A is assessment. They also call it application. I don't remember it being application when I was in school, but it's fine. Things change. Adapt. P is planning. So those words together, the first initial forms the word soap. And that's the order you have to do it in the soap order, S-O-A-P. So S, subjective. That means client complaints. So the way I like to explain this is S, so clients, what they're saying is happening. So this would be why they're there, frequency, their pain scale, what aggravates it, what might relieve it, and what their goals are. You can put any of that information in S, subjective. Objective means what we are observing. So practitioner observation. So S, client says. O, therapist says. So this is what we find. This might be range of motion things we're noticing. Details of the treatment. Maybe they have it. I'm just going to keep saying elevated shoulder, because that's an easier one for you guys to see now while you're all sitting. Elevated shoulder. You would put that observation in your O section. Details of the treatment. Maybe you worked on the trapezius, the levator. You guys don't know what these are yet. The rhomboids, serratus, all that to kind of bring that shoulder down a little bit. And this is where you would put specific muscles you worked on. I don't know why it says treatment goals. I feel like that's a typo. That should be in planning. Assessment or application. So I was taught S, what client says. O, what we see. A, assessment, changes after the massage or what happens. So that I typically will, in assessment, put right elevated shoulder dropped some, or muscle tension reduced in these muscles, or overall. You can put pain scale reduced. This is where you would put what happened after the massage, like what the results are. Does that make sense? What they say, what we see, results. Also, since the book likes to throw application here, this is where you might put some more details, like what you were doing, like the time. Maybe I don't put this. I do it opposite, but that's just how I was taught. Maybe you would put 60-minute relaxation massage or 60-minute deep tissue. I always like to put what the pressure indicate or pressure index was. Deep pressure or maybe medium pressure. So you can go back and look at that. That is not necessary, but I like to teach everybody that so that you can see what John got or what Lauren got or whatever. Planning is always the client homework. Advise client come back in 3 weeks or come back monthly until whatever resolves. You might want to say recommend using hot stones or cups next treatment, or myofascial release or some other treatment to try to work out these problems. So that's where planning. I feel like PE planning is really easy. It's usually objective and assessment where it gets muddled. Here is an example. Soap note example. S, subjective. Client, it says C-L, complained of. That's a good abbreviation for complained of. Chronic headaches and difficulty turning head to the right. When you do left or right, make that R capital or the L capital. If you are handwriting these, standard is usually put a circle around the R or the L. If there's, we'll see, there's bilateral in the next one. Turning head to the right. So that means they have a lot of headaches. They have difficulty turning this way, right? Pain scale is 6 out of 10. So it's more than just an average ache. It's a little more intense. Objective. So this is what I'm finding on the client. Tension is present in their suboccipitals. So that all these muscles I'm listing in the first section are neck muscles, right? So we're talking about posterior neck. Then I have something called splenius capitis. The traps, you can put trapezius, but I like to abbreviate. Pec min means pectoralis minor, scalenes, SCM. So here's your listing, the muscles that you're finding tension in. Right shoulder is elevated. And then I put here limited range of motion in the neck with lateral flexion. So that means this, lateral flexion. And bilateral, B-L means bilateral. That means both sides. So that means they're having limited range of motion, rotating it both directions, not just where they're feeling the pain. Where they're feeling the pain isn't necessarily the problem area. I know that that is confusing, but we're going to learn this as we manually do the massages on everybody by touching and palpating and doing consultations. So today when you guys work on each other, do a little mini consultation. And I'm going to have you guys do intake forms and all that to get used to it. Such a fun day. Assessment. So this is where I don't put this section. I always put it in O, and I tried to fix it, but I'm such a creature of habit that I can't change it. So assessment, this is where I put 30-minute TM. For me, TM means therapeutic massage. Right? And you could put full body. Mine is F. I'm going to write it down. Oh, I keep forgetting my pens aren't there. So I have FBMT, and you're like, what in the heck does that mean? That is an abbreviation for full body massage therapy. So if they did full body and nothing was omitted, you can put that there, that they did full body, or you can put full body. I just like to abbreviate because it's simpler. I put the medium firm pressure here because I like to know. And then the assessment range of motion was improved with the right neck rotation. Got it? And you guys can abbreviate how you want as long as you know what you're talking about. Headache pain reduced to 2 out of 10. Now this means you have magic hands. Typically it might bring the headache down a little bit, but a lot of times the headache's not going to just disappear from the massage. It's going to kind of slowly alleviate throughout the day. So don't feel bad if their headache doesn't go away because you massage them. You might need those endorphins to kind of kick in. systemically throughout the body. P, plan. I put drink plenty of water, massage 2 times monthly for pain reduction and increased neck range of motion. So that's my plan. They might not stick with this plan, but this is at least what you are telling them they should do. 2 slides to go, guys. Update records and confidentiality. So handwritten records should be legible. So if you aren't doing it on the computer, make sure you can read it. Make sure you can read your client's forms and have things dated and signed so that you know when it was filled out. You must get consent from clients when sharing information with other medical providers. This will be your release of information form. Just because you both have the same client, you and your chiropractor, doesn't mean you can talk about them together. That is a HIPAA violation. If you want to consent with another doctor or another provider, ask permission, get a signed, informed release from your client, and then you can contact their provider and discuss a treatment plan with your combined knowledge. All right, sometimes you need to release information ordered by court. So if the court wants information on this client, it is no longer a HIPAA violation. The court will send you a letter and you will have to provide the information you have, okay? So this might be, a lot of times it could be if somebody's getting sued, workman's comp, stuff like that. And I have had to fill out these release of informations for court-ordered stuff. And don't get scared if you see a letter from the court. It's usually something like that. HIPAA. Not to be confused with hippo. So HIPAA, you guys have probably heard that, and there's not 2 P's for the love of God. HIPAA is the Health Insurance Portability and Accountability Act. This is safeguarding your client's personal information. So because of this, we need to obtain signed copy of an informed consent. That's why we need it. We are not allowed to share their health or their personal details with a third party without their permission. If they find out, you can get sued. You want to store your files in a secure, preferably lockable, fireproof cabinet or online. If you are doing things online, make sure your clients don't have access to the forms. So you might have to click out of your programming or your app so that people don't snoop or sign out of your session or whatever. Where am I at? Digital files must not be accessible to third parties. Password protect. Your computer should have a password on it so nobody can just walk around your lobby, look at your computer, and look up file information. Now, that's weird. I don't know anybody who's done that, but just make sure you cover your butt. Keep info out of view of others. Like, I'll have a client. He's notorious. I don't know why he does this. He's sweet, though. He'll always do the checkout on the side of my desk. And that's like straight view for my computer. So I have to like click out of my scheduler because he just wants to pay there. I don't know. There's even a display there. But that's what he wants to do. So be mindful that your client can't see your screen. Mirrors are cool and all in Windows, but make sure there's not a reflection that they can also see your computer and your other client information. This also goes with just having them know who's there. They're not allowed to know who is at your office. So I know this is kind of a blurred line here because I have couples that come in and they're like, oh yeah, so-and-so is going to be here next week. Like they already know each other's schedule, but you also shouldn't overindulge that. Maybe Jennifer doesn't know that her husband's getting massages and he's keeping it secret because she's a jealous person. So you don't want to be like, oh yeah, your husband was just in. You know what I mean? Like that is their problem. They get to work it out. We're not allowed to tell when people are in our office. Does that make sense? Here's an example of what a release of information might look like. So you're going to have your client's name, our name, so their name, the practitioner's name. It might include a period of treatment times, maybe from October 1st to November 7th, we'll say, for funsies. And then at the bottom it says, I retain the right to revoke this permission at any time, verbally or in writing. And then the client would sign it. And then you can release information. Make sense? So it's always good to make these forms ahead of time. If you're in a pinch, you can find a template online and then put in your own information or have ChatGPT do it. Anybody have any questions over that? All right.